Hi, everybody. I'm State Representative Lindsey LaPointe from the 19th House District, which is the far northwest side of the city of Chicago. I am the House Chair of the Mental Health and Addiction Committee. I am also a licensed social worker, and we are here today to give an update on what is this year's top priority behavioral health care access bill, and that's HB1085. There's also a Senate companion bill, which is Senate Bill 55, and that's led by my friend, State Senator Karina Villa. So HB 1085 passed the House Mental Health and Addiction Committee today. It passed the committee with bipartisan support. And that is a reflection of behavioral health access being an all-partisan issue that affects so many people in every corner of Illinois. And this is an issue that speaks to people because it doesn't matter your party. People on the ground, us, our families, our neighbors, our constituents, are having a very hard time accessing behavioral health care with the commercial insurance that they and we already pay for. I'm really grateful to the people standing behind me. I think all of them are co-sponsors of either the Senate bill or the House bill. And that is a reflection of this being a top priority behavioral health care access bill this session. So real quick, before I hand it over to Senator Kaler, HB 1085 and the Senate companion tackles the problem of inadequate commercial insurance networks when it comes to behavioral health care. And what that means in very human language is that our behavioral health providers are not joining insurance networks, and they're not joining because the reimbursement rates that our commercial insurance companies pay have been endemically low. And they've been endemically low, especially when you compare them to the reimbursement rates for physical health care. So reimbursement rates. The red tape that providers have to face and slay through to join these commercial insurance networks is far too high. So that puts us in a situation where our therapists and our psychiatrists are saying, I'm not even going to take insurance. If you want to access behavioral health care, you can pay out of pocket. So now this becomes a cost of living issue for the people we represent, and frankly, for us too, when we go to use our insurance. We pay our monthly premiums, we need regular therapy, we need a psychiatric visit for our kid, and we cannot find a provider that takes insurance, and so we are paying $150, $200, even $300 to access that visit. This bill directs insurance companies to have a rate reimbursement floor. And the bill cuts a lot of the red tape that our providers have to face. So we're going to hear more about it from people, and with that, I'm going to hand it over to Senator Kaler.
Thank you, Representative. Dave Kaler, I represent Peoria and the Bloomington-Normal area. So this bill is really important for several reasons. One is it ensures fair access to mental health care. And not only access, but affordability. And so if you cannot find an insurer that, or a provider that will accept insurance, especially if you're talking about Medicaid, then the accessibility goes out the window. So this is, mental health is one of the big issues that all of our communities face, this nation faces. And so we have to make sure that we have accessibility and affordability. We have to be able to hold insurers accountable. These things don't just happen on their own. I think people oftentimes when they see things that are provided in society, they think, well, that's just because these folks really want to do the right thing. Not always. And so we have to put these kind of guidelines in place to say, okay, here's what's important to the population, and here's what you have to do to meet that need. And this is one of those cases. It protects families and communities. There's not a single one of our communities that are not struggling somehow with issues of mental health, whether it be adolescent mental health, whether it be adult mental health. This is a crisis issue for all of us. It improves not only the quality of life in our communities, it improves workplace stability. It helps just across the board. So this is an important bill. And it's a bill that's going to pass, and Representative LaPointe mentioned that this is a bipartisan bill. This is going to pass not only because we have excellent sponsors in both the House and the Senate, with Senator Villa carrying it in the Senate, but because this is an issue that our constituents in our communities demand. They want to be able to solve this problem, and we're going to help them do that. So am I introducing somebody? Okay. And so now, the Senate sponsor of the bill, Senator Villa.
Thank you, Leader Kaler and Chair LaPointe. My name is Karina Villa, and I'm the Illinois State Senator for the 25th Senate District that encompasses parts of Kane, DuPage, and suburban Cook counties. Although my title now is State Senator, my favorite title that I've ever held is Miss Villa, School Social Worker. As a school social worker, I would work closely with students and families. Sometimes a student would come in and disclose some issues with anxiety, some issues that were, yellow flags for potential issues with depression. I would call the parents in and have conversations with them. Now imagine yourself in that moment. You're at work and you get a call from the school social worker asking you to come in to have a conversation about your child. You go in, and upon hearing some of these issues, you do what's right. You call your insurance company. The same way that you would call if your child told you, I have some pain in my tooth, you'd call to see what dentist is available through your insurance. So the first thing you do is you take this very seriously and you call your insurance to try to find out who your providers are. Who are the options for your child to go and see a therapist? Lo and behold, the list is maybe 8 weeks, maybe 2 months. In that time, you say, okay, I'm going to take that appointment. In the meantime, I'm going to keep an eye on my child. You notice the anxiety increasing. You notice the child potentially saying, I don't want to go to school. The child potentially not wanting to get out of bed. You start seeing these signs, and as a parent, you're feeling so desperate, you don't know what to do. You call that school social worker again, and you say, what do I do? In that moment, the social worker gives you a list of referrals, but again, the wait lists are unbelievable. So you find a therapist finally that'll take cash payment. Think about that. You've been paying for your health care. You've been paying for your insurance. But you have to now start paying $150, $200 out of pocket just to get your child the help that they need and deserve. This issue now is escalating, and you're seeing it in your child's face, and as a parent, you think, what have I done wrong? But that's the wrong question to ask. You have done nothing wrong. You have paid your premiums, and you deserve for your child to be able to go in and get help when they need it. This bill is the most important bill regarding mental health that we can make sure to get across the finish line. Our children and ourselves. That story doesn't just go for children. That story goes for us too. If you're feeling anxious and depressed, and you want, and as an adult, to get assistance and help, it's almost impossible to get on those lists, to call your insurance provider and say, give me a list of names. House Bill 1085 passed today out of committee. It's going to pass on the floor. When we get it in the Senate, as Leader Kaler said, we are fully committed to making sure that this bill gets across the finish line for the people of the state of Illinois. Thank you.
Hello, my name is Carrie Carlack, and I am also a clinician, and my advocacy for this very, very essential bill is threefold. So I've had the responsibility and privilege of leading health systems in behavioral health for many, many years, over 20 years. The second tier is as a mother of a child with a lived experience. At the time I was seeking care for my son, I was the CEO of a hospital, I was the board president of NAMI Metro Suburban, and I had commercial insurance. All sorts of access and privilege. All sorts of access and privilege, and I couldn't find a therapist for my own son. People wouldn't call us back. People weren't accepting insurance. We ended up driving several miles into the city. We live in the suburbs to find a therapist. And that began to become absolutely unacceptable, that we already had insurance. We're paying for our insurance, and I couldn't access preventative, thoughtful, trauma-informed care for my own child. So that mission pivot is a thirdfold. So now I'm the founder of Mosaic Counseling and Wellness, which is an integrated practice. And when I say integrated, I mean psychiatry and therapy within one team, and creative arts and BIPOC and bicultural clinicians within one team. who actually coordinate care and talk to one another. So now on the employer side, I need to ensure that I attract and retain the most talent so that our clients and patients receive timely access to care. If Mosaic Counseling and Wellness is not the right place, we need to reach out to other community providers so that the waiting list is not 2 months, 3 months, 4 months. So in order to attract and retain talent in our community, we also have to pay well so that we need to be reimbursed fairly so that we can provide this very essential care. Thank you.
That is a true reflection of the diverse support across both chambers that we have for this bill. For House Bill 1085, we have more than 40 co-sponsors of the bill. We are committed to passing this because we are in a behavioral health crisis. With that, happy to take any questions if folks have them.
So it seems like the really big sticking point right now on this legislation is the mandating the reimbursement rate, that piece right there. The insurance says it's just not something they want to set that precedent. I wonder if you could just speak a little bit about why that reimbursement rate, setting that in statute, is so important for this, to address this issue.
Yeah, great question. And that there is red tape in the administrative burden component of the bill, but the rate reimbursement floor is really the core of the bill. And the reason that's the core of the bill is because when you take the time to actually talk to therapists and learn about what their reimbursement rates have been for, let's say, 60 minutes of psychotherapy, you hear things like $100, $130, but more importantly, you hear that there's no real negotiation taking place with the insurance industry, and you hear that these therapists have not gotten any raises in 10 years. And that rate reimbursement floor is what is going to incentivize and compel providers to actually join networks. With the current status quo, as we've said, providers are losing money when they take certain insurance plans. And so they're making the very hard choice to say, I'm just not going to panel or contract with this insurance company at all. So the rate reimbursement floor is really a fundamental part of this bill that will meet the goal so we get true behavioral health care access.
And it was touched on a little during committee, but it's tied to Medicare. What's the decision behind tying it to Medicare outside of Medicaid or any other sort of figure?
Yeah. So as we know, Medicare rates are established by the federal government. There's a fee schedule that we can all look at, and leading healthcare actuaries have all pointed to that benchmarking rates to Medicare is a very appropriate mechanism to use. There's a leading stakeholder called Millman, and a lot of the logic behind this bill is based on a very compelling report that they put out not too long ago. And then there was another report just in 2024 from the Research Triangle Institute that laid out Illinois-specific data to show that we are endemically under-reimbursing behavioral health care providers, especially when you look at it through a Medicare benchmark lens. So in sum, the leading stakeholders say that benchmarking to Medicare is very appropriate.
I remember many subject matter hearings they held last year about this, and throughout even the summer months, talking about the importance of having this in place. For the folks at home that are saying, finally, it's happening, what do you say to the people at home that have waited for so long to see this potentially happen? People have waited years and maybe weren't able to get a provider in Peoria or Decatur.
Our message to them is that you deserve this. You have long deserved this. Behavioral health care is health care. We shouldn't treat it like some other, and it's just unacceptable for us to reimburse it at far lower rates. So the message is you deserve it. Everyone deserves to be able to use the insurance they already pay for. You're already paying your monthly premiums, and because behavioral health care is health care, we need to make changes in statute so you can use your insurance for the behavioral health care that you need.
Obviously, you already know that you have bipartisan support for your bill, you know, a long list of people. How critical is it to see that this is a nonpartisan issue?
At this moment in time in particular, where there's a lot of partisan consternation at multiple levels of government, it means a lot to have a bill, to have a legislative issue that people from all corners of Illinois and from all parties are rallying behind. And I think it should mean a lot to people. We all care about this. It is a long time that we slay stigma and create real access to care.
I'm not sure if any of the stakeholders, any of the provider groups can talk a little bit about just what this would mean for them, you know, if this does get implemented, what this would mean for their reimbursement and just their ability to provide care for individuals.
Yeah, do you want to answer that, Carrie?
Sure.
In short, increasing access to care. So being able to attract and retain more clinicians, draw more people to the field, and just expand access. There are some places in the Chicagoland area, which is densely populated with clinicians, and you call and someone says 6-month wait. A 6-month wait, by the time you pick up the phone to access care, whether it's your ACL or your spirit or your mental health needs, you need care then, and you need people to be responsive. So I think increased access to care, increased quality care, integrated care, psychiatry and therapy within the same day, which is a trauma-informed system of care.
Can any of you also talk about the impact this could have during a time where the federal government is taking away healthcare rights for many people? Obviously, we haven't seen exactly what will happen, but there's a lot of people are scared right now.
Yeah, I mean, I'm happy to answer that. Okay. As we've been over, healthcare access and behavioral healthcare access is something that everyone cares about. And in these times where there is so much instability, there's so much unknown, there's a lot happening at the federal government that none of us have direct control over. When we have a bill pending in Springfield that is in our control, that will make a significant impact in the lives of our families and the people we represent to get more behavioral health care access, there are just no excuses for not doing that. This is in our control, and we have to move forward, which is why we are so committed to passing this bill this year.
Thank you.